Hi, my name is Kevon, and this is Jack Smith. We've been talking about common factors, and the third common factor is modality. Jack, sometimes people call me and say, hey, do you guys do EMDR? Do you do hypnotherapy? Do you do PCIT? Do you A, B, C, D, E, F, G therapy? Jack, what do you say to that?
Well, we learned a little bit about every therapy as we took our classes and stuff through college and through our master's program and doctoral, by the way. But some of those modalities you have to get certified in. Some of them you have to get special certificates for, or whatever. But I think again, once a counselor realizes what he does well or she does well, that's the modality you should generally use. There's different parts of different modalities that you can use for different things, but I think that the main one that you go through is the one that you feel the most confident with, the one that you can be the most genuine doing, because nobody likes a fake counselor or somebody that's coming off like they don't know what's going on.
The great debate, which modality is the best, and it actually began with psychoanalysis and cognitive behavioral, but what we found was when you line all of them up, there is no modality that is empirically more sound than the other across the whole. Like if you were to take any one of them. And so what I would tell you is you want to find a therapist that's confident in the modality that they use and competent in at least a modality. Now, we learn lots of them for different tools. Jack's reality therapy, we both are NLP, we're both CBT, we both have some exposure and some training in DBT, but it doesn't particularly matter. The modality, for most things, there's always weird, strange things that are specialized, but for the most part, when you're talking about counseling, if you connect to your therapist and you spend time, what Common Factors has shown, and Common Factors is a wildly longitudinal study, is what it's found is that time and relationship account for 70% of the positive change that happens in therapy. Only 15% accounts for the modality that's happening there. So, you just kind of want to make sure that your therapist is competent in a modality or knows how to integrate the modalities that they're using.
Yeah, I think even if you take this into and look at like sports as a coach is going to have a certain way he likes to coach, a certain style he coaches with. If all of a sudden he just changed it up and did something completely different, he probably wouldn't be as effective because he's gained confidence and stability in his style. I think that's the same way as a counselor. Once a counselor gets into this, the counselor will know what he or she likes and what he or she is proficient at.
You can get distracted because a lot of the therapies and modalities are very popular. They come in waves. I think right now we are deep in the EMDR wave, and there's nothing wrong with EMDR. It's just that you wait a year and everybody will be pushing for a new acrostic of therapy. Don't get so bogged down by that you miss the important parts. Like, does my therapist and me connect? Does it feel like they understand me? Does it feel like they care what's going on in my life? Do they have the availability necessary to see me enough that we can actually talk and go through these things together? The modality, if you run into a modality with Jack, one of his modalities is reality therapy, and Jack, man, he won't sugarcoat it unless I were to say to him in a therapy session, I just don't like that approach. I don't like the way that you're approaching that one. Jack's competent enough in so many different therapies that he could integrate into something else. One of the questions I ask in people's intake is, have you been in therapy before? And if so, what worked and what didn't work? So if you tell me that they had you sit and talk to an imaginary chair, I'm going to know exactly what modality that you're talking about. Yeah, we're both going to know exactly what modality you're talking about. And we're going to know, hey, wait a minute, they're not going to want a confrontational or a weird feely therapy. Maybe they want a more applicational, or maybe they want more of a how did I get here based therapy.
Yeah. So, all therapies work in some way. You can take good things and pluck good things out of every type of therapy there is. It is important to know who's in your office and what kind of therapy to do. But generally, we all have a therapeutic modality that we like to work through. And most of the time, there's a probable chance that modality will work in your situation. And we can tweak it a little bit with other things that we do as well.
Ask the questions. Find out what modalities of therapy work. But don't pay more attention to modality than you do to relationship. It's not the most important part.